Hello and welcome to Marvin AME Zion Health Ministry. We hope that you will find today's topic both enjoyable and informative. At the Marvin AME Zion Health Ministry, we are committed to promoting health and wellness within our community. Today's topic is one that we think you will find interesting and valuable. We have carefully selected it to provide insights and practical tips that can positively impact your health journey.
What is depression? Let's start at the core. What is depression? It's not merely a fleeting sense of melancholy, it's a mental health condition that extends beyond transient feelings of sadness. It's akin to having a persistent storm cloud in your mind, influencing thoughts, emotions, and day-to-day life. Diagnosis. Understanding how professionals diagnose depression is crucial. Unlike a straightforward physical examination, mental health experts refer to the DSM-5, a manual listing various mental health conditions and their symptoms. A depression diagnosis typically requires consistent manifestation of specific symptoms for at least 2 weeks. Symptoms. The symptoms of depression are varied but recognizable. Persistent sadness, loss of interest in previously enjoyable activities, changes in appetite or weight, disrupted sleep patterns, fatigue, difficulty concentrating, and, in severe cases, thoughts of death or suicide. These are the common signs to look out for. Why does depression happen? Delving into the reasons behind depression reveals a complex puzzle with numerous pieces. Genetics may play a role, with a family history of depression being a significant factor. Life experiences also contribute, as challenging situations or significant life changes can act as triggers. Visualize our brains as intricate machines. The chemicals within our brains regulate our mood. When these chemicals become imbalanced, it can lead to depression. It's not just an emotional state, it's a genuine, physiological occurrence within our brains. For some individuals, antidepressant medications may be prescribed. These medications assist in balancing brain chemicals. It's crucial to note that medication is one part of a comprehensive treatment plan and should be administered under the guidance of a healthcare professional. Self-care. Now, let's delve deeper into the concept of self-care. Imagine your mind as a garden, and self-care as the sunlight, water, and nutrients it requires to flourish. Taking breaks, indulging in activities you love, and allocating time for yourself are essential. It's not self-indulgence, it's self-preservation. Depression is more than just feeling sad or going through a rough patch. It's a serious mental health condition that requires understanding, medical care, and often a great deal of compassion and support. Depression can affect anyone, regardless of age, gender, or background. It's characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in activities. It can also lead to a variety of physical and emotional problems and can decrease a person's ability to function at work and at home. Feeling sad or having a depressed mood. Loss of interest or pleasure in activities once enjoyed. Changes in appetite, weight loss or gain unrelated to dieting. Trouble sleeping or sleeping too much. Loss of energy or increased fatigue. Feeling worthless or guilty. Difficulty thinking, concentrating or making decisions. Thoughts of death or suicide. Symptoms must last at least 2 weeks for a diagnosis of depression. If you're experiencing any of these symptoms, it's important to seek help from a healthcare professional. Now, let's talk about the causes of depression. It's often said that depression results from a chemical imbalance, but that's a bit of an oversimplification. It's not clear what causes depression, but a variety of factors are likely at play. These include biological differences, brain chemistry, hormones, and inherited traits. Depression is also more common in people who have a family history of the condition. However, it can also occur in people without family histories of depression as well. Major life changes, trauma, stress, and certain physical illnesses and medications can also trigger depression. Depression is a treatable condition. However, many people with depression never seek treatment. But most people with depression feel better with medication, psychotherapy, or both. If you think you may be suffering from depression, it's important to seek help as soon as possible. The symptoms of depression can be diverse and affect both the mind and body. They may include a persistent feeling of sadness, anxiety, or emptiness, feelings of hopelessness or pessimism, irritability, feelings of guilt, worthlessness, or helplessness, and a loss of interest or pleasure in hobbies and activities. Physical symptoms can include decreased energy or fatigue, difficulty sleeping, overeating or appetite loss, and persistent aches or pains. Now, let's talk about the diagnosis of depression. If you're experiencing some of these symptoms and they've lasted for more than 2 weeks, it's important to reach out to a healthcare professional. They can conduct a thorough evaluation, which may include a physical exam, an interview, and lab tests. The purpose of these tests is to rule out other conditions that may have similar symptoms, such as thyroid disorders. Once other medical conditions have been ruled out, the healthcare professional may refer you to a mental health specialist, such as a psychiatrist or psychologist. These specialists can use specially designed interview and assessment tools to evaluate a person for depression. Treatment for depression often involves a combination of medication, psychotherapy, and lifestyle changes. Antidepressants are medicines that treat depression. They may help improve the way your brain uses certain chemicals that control mood or stress. You may need to try several different antidepressant medicines before finding the one that improves your symptoms and has manageable side effects. Psychotherapy, or talk therapy, is another effective treatment for depression. It involves talking to a mental health professional to learn to cope with negative thinking and use behavioral skills to combat depression. Cognitive behavioral therapy, CBT, and interpersonal therapy, IPT, are types of psychotherapy that have been scientifically shown to be effective in treating depression. Lifestyle changes can also play a crucial role in managing depression. Regular physical activity and avoiding alcohol, nicotine, and illicit substances can help manage symptoms.